High blood pressure. The following content is not to be construed as medical advice. As everyone knows, we are a down payment assistance grants program. Recently, in one of our business opportunity overview calls, one of associate members mentioned he had high blood pressure, so we went off topic and talked about high blood pressure. So, let's talk about primary and secondary high blood pressure, and then let's talk about metabolic syndrome. Primary hypertension is said to have unknown causes, with no cure for it. Secondary hypertension is caused by kidney damage. Doctors would, however, give you treatment with medication, tell you to avoid salt, and put in diuretic medications. You can revert. Metabolic syndrome. Metabolic syndrome present high blood pressure, high cholesterol, high sugar, and belly fat, and is all caused by insulin resistance. Insulin resistance causes high blood pressure. Insulin becomes highly inflammatory, which irritates your arteries. Cholesterol then wants to heal your arteries, except for cholesterol and calcium hardens your arteries. While all this is happening, you are getting sodium retention, which causes low potassium, because sodium and potassium work together. When you have high sodium, you have low potassium. And vice versa, when you have high potassium, you have low sodium. You need potassium to reduce high blood pressure. Potassium has important electrolytes that help heart muscles contract and relax. Insulin resistance blocks the absorption of potassium, which then elevates levels of sodium. Sugar raises insulin, insulin blocks potassium, stress blocks potassium. The sympathetic nervous system makes you stressed, stress blocks potassium, and produces cortisol and adrenaline, which keeps you stressed. The sympathetic nervous system does not turn off automatically. You have to turn it off manually. Here is a guaranteed way to lower high blood pressure. Potassium and magnesium cause electrical inputs that help contract and relax heart muscles and tissues. Red beets are extremely effective in lowering blood pressure. You can bake them, cook them, juice them, or blend them. Beets can also be bought in powder. Red beets work well in reducing high blood pressure because they have the highest amount of potassium, and most importantly, because they produce nitric oxide in your blood vessels, which becomes a vasodilator. Nitric oxide can equalize your blood pressure from head to toe and even stop a heart attack. Spinach, blueberries, kale, and bananas are also excellent in lowering high blood pressure. So, you can blend them in a shake with beets. A formulation of L-arginine and L-citrulline called Pro-arginine is also very important because it produces nitric oxide. As well, vitamin K2 removes calcium from arteries in all soft tissue and then transports it to bones. Therefore, it removes plaque from arteries and removes calcium from kidneys, muscles, and other organs, which then reduces inflammation and disease. Vitamin K2 could also prevent kidney stones. Inflammation caused by calcium in soft tissue is the root of most diseases. And let's just say that cancer has a high incidence of growing where there is chronic inflammation. Niacin also helps by preventing triglycerides and by helping with the production of energy in your mitochondria, which promotes cellular health, enhances cellular reproduction, life extension, and protects your DNA and acts as an anti-aging agent. So, eat kale, beets, spinach, and blueberries. Cut out sugars, take vitamin K2, take vitamin D3. The vitamin D3 is very important. It is a hormone modulator. Take L-arginine, take L-citrulline. Do intermittent fasting, consume a ketogenic diet. Reduce stress. Snaking is not a good thing. Every time you eat any amount of food, it spikes your insulin, therefore fasting can revert insulin resistance. 16 to 18 hours of fasting produces growth hormones. Fasting can also cause autophagy. Autophagy, a stage in which the body recycles damaged proteins, microbes, fungus, mold, and yeast. Fasting can also cause the release of stem cells and reduces inflammation. The parasympathetic nervous system turns off the sympathetic system. To do this, simply do breathing exercises for 5 to 10 minutes. Take deep, slow breaths, hold them for a few seconds, and exhale slowly. This manually turns off the sympathetic system and instantly reduces high blood pressure. Magnesium. Taurate magnesium reduces blood pressure. Magnesium reduces stress. Magnesium helps you sleep. Magnesium improves brain health. Magnesium improves dementia. Magnesium improves memory. Magnesium reduces migraines. Magnesium protects the heart. Magnesium improves muscles functions. Magnesium protects mitochondria. Magnesium protects cell walls. Magnesium protects DND. Magnesium improves type 2 diabetes. One last thing, drinking too much water can flush your potassium and electrolytes, so add electrolytes to your water. Lemon is an example. Eat less frequently, do what you can to revert insulin resistance. All this could reduce high blood pressure, revert cardiovascular disease, and prevent strokes. And remember, put God first. God bless everything you do, and our company.